Good morning, good afternoon, good evening, good vibes, good energy, good people. It's your boy Mickey Fenty, aka Mickey Made It. If you're new to this channel, you know what to do to this channel. Subscribe right now. Also, if you want to support my brand I'm building with you guys, the community, inspiredbydreams.shop. That's the place to go check out my styles, all original pieces for you to get your dress outside of the box on. Okay, today's episode, what I really want to break down today, this is very important. And I felt like I wanted to bring this conversation to you guys. And it's medical tourism. Now, when it comes to health, when it comes to medical issues, the more you learn, the more you misunderstand. There's so many different things. In my head, I'm thinking, I see a lot of models on social media. They travel so far out to get body shapes and different things done to their body. But they got deeper than that. What about the people that can't pay for their medication? They don't have health care and they have to travel so far out just to get the right medicine for their families and things of that nature. It's deep, you guys. The healthcare issues are way greater than some of these topics people are really highlighting. Let's more think about the things that means more to our health than the things that's just upgrading our wealth. And things will balance itself out. So let's jump right into it. See what you guys think. And you guys know if you want to continue this conversation on my live show, it's Mondays, Wednesdays, and Fridays at 9 a.m. Let's get it.
Mickey made it. Mickey made what you made, Mickey.
Forget about the way it used to be. This is not a damn democracy. We are in a state of emergency, and my word is law.
So did y'all see the video of the woman who flew all the way to Turkey to get all of her medical diagnostics, blood work, and stuff done at a state-of-the-art hospital?
I flew to Turkey to get the most in-depth checkup of my life, and it was the greatest thing I've ever done for my health and my bank account. Doing this in the US would have cost me thousands and taken months to line up, but in one day, we're doing it all. Scans, tests, meetings with specialists, and the price of everything is jaw-dropping.
That video seemed to have a lot of people in an uproar, but I have two thoughts. The first is sometimes take things from creators with a grain of salt, because 9 times out of 10, Turkey flew her out and the facility probably didn't charge her for the services that she received. That was an advertisement. However, secondly, I definitely and strongly believe in medical tourism, especially as somebody who has lived abroad for the past couple of years. I've talked about this a lot on my page because I gave birth abroad and traveled the entirety of my pregnancy. I received the bulk of my medical care while pregnant overseas. I've been to medical facilities while living in China. I gave birth in Europe and had my postpartum care there, dental services in Mexico, and also got LASIK eye surgery while living in Cancun. The most important thing that I can say about medical tourism is that, number one, it's not going to be accessible for everybody. Everybody's not going to be able to fly all the way to Turkey to get their medical diagnostics done. But there are places closer to home like Colombia or Mexico where people have gone for medical tourism. And also remember that these videos are traditionally not made with disabled folks in mind. It's usually somebody who's extremely healthy from the outset that's mobile to be able to go and get this medical tourism done. Also, it's important to do your own research. I have seen other situations where stuff gets sticky and people are driving over the border of Mexico, having done no research, talked to any real people, gotten any real authentic reviews about a place, and well.
Let me tell you how raggedy the U.S. healthcare system is. So I had an experience recently out on the East Coast in Jersey with the healthcare system, and then I'm contrasting that with my experience in Panama City, Panama. So here in Jersey, I'm dead ass just trying to do a quick follow-up on an emergency procedure I had in Panama. And I'm like, okay, let me look. So first, in the US, I have to actually only go to dentists that's within my healthcare plan, unless I'll have to pay the out-of-network costs, whatever. So already that's an additional step. So I did that, found like 10 places that are in an area that I will be covered by. Went through, called those places. One place was like, oh, well, we're booked out 3 months. Another place was like, I don't even know when we could be able to get you in. Others were like, oh, well, you're a new patient, so it's going to take even longer. So I'm like, okay, well, I'm trying to get seen kind of within the next few days before I move and travel again. and sort of nobody was helpful. So then I found another place that pretty much does like drop-in, walk-in clinics. And I was like, okay, cool. So they have an urgent care and primary care. And I was like, bet, let me go there. They have like on-call doctors and dentists and stuff. Went there and they're like, oh, well, we don't accept your insurance. I'm like, I have insurance. It should be covered. It's actually like based out of Maryland and covered by my employer. And I'm like, oh, only these two certain insurances, like 2 out of all of them in the whole country are accepted here. I'm like, okay. And it was like, oh, or you could pay out of pocket. And I'm like, I'm not paying out of pocket. And then they were like, well, you can, if you having symptoms, then you can be seen. I'm like, so you have to actively be seen in order to actually get treatment or care. She's like, yeah, no preventative stuff. I'm like, that's just so ass backwards. Like, the US has it all wrong. Like, it's not until you're sick that you can actually get the care that you need, and in a quick fashion. So I'm like, no, I'm not coming out of pocket. I'm not paying. My copay, I think, for urgent care is already just $60-$80 out of pocket right there, let alone the additional costs that I'll have to pay in order before I reach the deductible. So all this BS is going on. This is in complete contrast to my experience in Panama, where literally Thursday I was coming from Bocas del Toro, and I was like having pain while I was there, and I was like, okay, cool, let me find a dentist and try to find somebody the next day. I'm like, damn, it's Friday, it's going to be really hard. I literally found somebody who is bilingual, and like these amazing facilities, and she was like, oh yeah, it literally was so easy. I was like, they were like, oh yeah, we can see you tomorrow. When facilities were beautiful, like beating most hospitals in the US. I think maybe Johns Hopkins, or I don't even know like what other ones, but it was like really pristine. It was like great. And the facilities are interesting because it has a bunch of like clinics there, so there are people kind of coming in and out. So there are multiple dentists office within there. There are multiple like medical folks there. It's just a whole bunch of stuff. Went there and I'm like, okay, same day, pretty much emergency visit. The facilities are beautiful, so I'm like, okay, facility fee. The physician fee that you usually have to pay for, I had to get an x-ray in office. I had to do a specialty x-ray and actually like go to another location that was in walking distance, but it was still a specialty x-ray. And then I had to get like prescription medicine and narcotics too. So I was like, oh, okay, it's going to be expensive, so let me just prepare myself or whatever for that. And literally all of that was like under $300 or something. It was probably cheaper than that too. But I was just like, this is crazy. It's just like in complete contrast. And now I'm just frustrated because I'm like, it's much easier just to literally travel to Panama. A lot of people go to Colombia for medical tourism to get stuff taken care of versus like waiting around in the US. And I'm like, unless I'm sick, then I'm like, oh, I have to go to the emergency room or urgent care, and then it's expensive. So I'm just like frustrated with the whole process. But yeah, guess I gotta book another flight.
Arguably, I'd say American doctors are the worst.
So as a health economist, there's a lot in this video I want to talk about. Go back and watch the video if you haven't already. But there are several points she makes in the video. The first is that American doctors are very upset about people going to other countries to have medical procedures because they don't think it's as good quality as receiving the same procedures in the... And medical tourism has surged over the last 5 years. In fact, we see an annual growth rate of 15 to 25%, with over $100 billion being contributed to the global economy through medical tourism. Now, again, how we define better, it can be based on a wide variety of metrics. We can talk about wait times and how fast people get healthcare. We can talk about how much it costs. We can talk about the quality of care for basic as well as rare diseases. So when we're talking about quality and how well procedures and doctors perform, we need to think about how exactly we're measuring that. For example, let's think about something like maternal mortality. If we're measuring the US healthcare system based on maternal mortality, it actually is very poor compared to comparable countries. However, if we're talking about something like a routine surgical item or a fragment of something being left in your body after surgery, the US actually performs the best out of the comparable countries. So again, when we're talking about quality, we really need to think about what metric we are measuring it. Here, the Commonwealth Fund attempts to rank 11 similar countries based on a wide variety of outcomes, namely healthcare equity, access to care, administrative efficiency, and it finds that the US performs the least out of these metrics. So among these metrics from this particular survey, you could say that the US has the worst performing healthcare system compared to these other 10 countries. And this is particularly shocking once you consider the fact that the US spends a way higher percentage of their GDP on healthcare compared to other countries. You can see here that line above everyone else, that's the US. Now, I agree with the person I stitched in that there are doctors around the world that are absolutely phenomenal. However, I will respectfully push back on her statement that US doctors are the worst in the world because they choose to become doctors in the US healthcare system. I don't think a lot of doctors go into the US healthcare system and realize how many barriers there are to them providing the care to their patients that they would ideally like to get. Not to mention the insurance system and the pharmaceutical industry. It is a wide network of things that only someone like myself, a health economist, quite understand as a whole. And it's not until they enter that healthcare system that they have an understanding of what's going on. Part of why I have this page is to help y'all understand all of the various players that function in our healthcare system, which is way more complicated compared to a national system like we see in the EU or other areas of the world. So I hope that was helpful.
Here in this country is so bad that it's driven people to go to other countries to get it, and it's not without consequence, and we need to be talking about it. Dr. Mom, I see kids, adults, and everything in between as a family physician, and we need to be having this conversation not just because of the poor people that were just found kidnapped in Mexico. 2 had been murdered, and they were there for someone to have a medical procedure, but because this is a symptom of a much larger problem, and I have seen other consequences that are not just the kidnaps, scary things happening, but the aftermath of these procedures. I'm not mitigating the horror of that and the kidnapping issue and all those other things about going to Mexico to have procedures done. But can we talk about how messed up it is that people in the US are having to go to other countries because they cannot afford procedures here? And I don't care if it's elective, I don't care if it's something that they want to be done just for ha-has. We should still have access to good healthcare when we need it, no matter what kind of healthcare that is. The biggest problems we have, we know, which is cost and access. That includes those of us who have insurance. For instance, just had my gallbladder out, as many of you know. And my out-of-pocket cost for my gallbladder with good insurance was over $3,000. That's like a 5-minute procedure. Okay, fine. Like when you get me back and all that stuff, it's like a 25-minute procedure. Most of that is not going to my doctor. In fact, none of what I just quoted you was going to my doctor. This drives people out of the country. The problem is they have no system for follow-up care. As somebody who practices medicine in Los Angeles, you are looking at the system for follow-up care for lots of people who go down to Tijuana and related locations. We've talked about this before. You know, it ain't pretty. Patients sent home with literally no instructions. Like, off the table, here are your pain meds for today. Go back to the US tomorrow and see your doctor on Monday. And they just had a full abdominoplasty, like full on tummy tuck. There are drains and things that have to come and go and all that kind of stuff. Like, we can't just be sending people out like that. These cases have ended up hospitalizing patients who have had complications from these procedures because, again, they just have no means of follow-up. Also, no counseling about adequate pain control and how to manage that. Somebody doesn't tell you how painful something's going to be for how long, and you're sitting there wondering if it's normal or not. It's terrifying. And if you didn't have money to get the procedure done in the US to begin with, you probably aren't going to be able to get care for the complications here either. Let me be the first one to say, this shit sucks.
All right, guys, so I'm seeing things like this comment again on my page, and I'm seeing recommendations for BBLs, tummy tucks, gastric sleeve in Mexico for less than $3,000. And we need to talk about it because the reality is there's wonderful surgeons and injectors all over the world, Mexico included. I know some of them, but they're not charging these super cheap prices. If you are going to Mexico and you're having something done for exponentially cheaper than what you spend in the United States, that should give you pause. The first question should be, why is this so much cheaper? So for someone like this who had a liquid rhinoplasty for $200, that probably wouldn't even cover cost of product. So you have to always be concerned when you're paying this little for an injectable that the injectable is from a split syringe. Who knows if they're managing it in a sterile way, if it's from a non-medical product or a counterfeit product. And I see this all the time, unfortunately. And you see all these happy stories on TikTok where people tell you how great their experience was paying almost nothing for cosmetic procedures. What you don't see is what us surgeons in the United States see is people coming up from Mexico having horrific complications, showing up in the ER in the middle of the night, having no one to take care of them, scrambling to find a plastic surgeon or doctor that's able or willing to take care of their complications. It's really scary, and I'm just not okay with it being advertised on any of my posts. So I'm going to start deleting comments like this. And I just want people to have a good understanding of what you're doing. If something is that much cheaper, there's always a reason why. They're cutting corners in some way. It's either a doctor who is not properly trained or certified, because why would they do it for so cheap? They're in a facility that is not properly maintained, using medications and supplies that are properly sterile or maintained. You have to be concerned about this. This is objective, guys. I'm not trying to keep people away from awesome surgery that's super cheap. I'm trying to save your lives, because people die from these procedures. Now, I know people are going to say this is just filler. It's not just filler. I've seen people with like some kind of weird chemical put in their faces, and their whole face became infected. They lost skin and were permanently deformed from things that were done in Mexico. And again, it's not Mexico. There's wonderful physicians in Mexico. It's this type of physician that does things for this cheap. You have to be careful of anyone charging so much lower than everywhere else in the world. It's just not normal. It's just not safe, and I'm just not okay with it as someone who takes care of these complications. For this commenter, I'm so glad you had a good experience, but let me tell you, I have lists and lists, as every doctor in Southern California does, of people who didn't. And we just have to stop recommending this. And I wish TikTok would start taking down the posts of people recommending these cheap surgeries all over the world. It's just not safe.
Well, what I could say, just like there are risks and rewards, there's dangers and benefits. In these times, we are dealing with a lot of people with these greed intentions, and they don't want the best for you like you want the best for you. So know that though, sometimes the people with the most money and the higher ups, they just think about getting more higher up and more money. And sometimes those people in the middle and the ones they look down on, the little people, they mean everything to the world. And when it comes to healthcare, the whole system, I think in America we can do a whole lot better for a whole lot of people, but we have to come to some way we can find some kind of trust and get some things resolved. And some of these health issues where people have to fly out to different countries and things like that just to get maybe better prices or just better care, whatever it may be. We all know that us as human beings, we can do better and treat each other better. Until next time, it's your boy Mickey Fenty, aka Mickey Made It. If you're new to this channel, you know what to do to this channel.